Well, today is about building new partnerships with the NHS for the college and our learners, developing pathways into provision for different care aspects, so not necessarily going into nursing but healthcare assistants and all the different multifaceted support roles that there are. The NHS came with the different HR managers and some of the professionals, occupational therapists, mental health nurses, to speak to the learners, to say to them, look, these are the job opportunities in the NHS. You don't necessarily have to go to university. You can come from the college to work in the NHS and build your career pathway.
It basically opens our eyes into what opportunities we have, and it's really useful because it just gives us a lot of information about the jobs and how there's not just one job for nursing, there's a lot that we could do with this course that we're doing at the moment.
We've had a really good turnout today. We've had lots of students come from the college. They're doing some presentations for our service managers, and the service managers are doing presentations to the students so that they can learn from each other.
And it's all about selling themselves and just realising that 2 years studying with work experience gives you lots of skills and qualities that any manager would be really interested in having. And it's just about saying you're welcome, come along, please apply, don't think that you can't.
I think it was wonderful for them to actually come into the college because a lot of college students find it very difficult to gain the experience that they need. But by coming to us and talking to us, it's been wonderful because the students now have a bigger insight into what opportunities are available to them.
What they've started to realise in the benefit of going on their work experience, so they've gone into homeless projects, different charities, worked with dementia patients, working in North London Hospice. What they're building up is a multifaceted approach to health and social care. So the original idea where they had when they may have come in, they're now starting to rethink that. So what it's doing, it's giving them options.
And it also shows that you don't have to go to uni, you can apply for a job and work your way to what you want to become in the future.
I think young people still think of the NHS as just being doctors and nurses, and what we want to do is to raise people's awareness of all of the different job opportunities and the opportunity to progress. If you go in at a support worker role, then there's a lot of training and development that young people can undertake and progress their career while they're working.
So many different things you can do in the NHS. It's like a country, isn't it? You can do so many different things. You can do catering, you can do finance, you can be a porter, you can do admin, you can work in IT, you can work in human resources, all of it. Loads of stuff.
College is the main reason why I've actually landed a role with these employers within the NHS. My aspiration's always been to work in the NHS, and I'm finally there. I'm at my starting point, and college is, if I hadn't come to college, these experiences wouldn't be open to me, these opportunities wouldn't be open to me. I wouldn't have the support of my teachers. My health and social care teachers have been absolutely amazing in helping me to do this.
I wasn't expecting them to show us a lot of information about how to apply for jobs and how we can apply for jobs now, and it's just been a really big eye-opener.
And I didn't know that you could work now and work your way up. I thought you just had to go finish a uni course, and I found that really helpful.
There are lots of support worker vacancies in London. There's also a critical shortage of nurses in London, and we are encouraging people to come in at support worker level and then learn and develop themselves, and a number of them progress on to nurse education.
You want the right people, don't you? And you want people that want to be there, and if these people have studied for 2 years to do a qualification to go and work in a caring profession, it's obviously something that they're interested in, and we just need to catch them and support them.
It's such a rewarding place to work because it's where you see that there are truly vulnerable people in our society that need our help. And for me to be a part of that, just a small fraction of that, a small percentage of the staff that work there, for me to make a difference to the lives of maybe 15 to 20 people that are on my hospital ward, it's absolutely amazing. Yeah.